সুপ্রিয় ছাত্রছাত্রীবৃন্দ, আজকে আমরা আমাদের লেকচারে স্ট্যান্ডার্ডস অফ ফার্মেসি প্র্যাকটিস বিষয়ে আমরা আলোচনা করব। সেই হিসেবে সেই পরিপ্রেক্ষিতে আমরা জানি প্রত্যেকটা ফার্মেসি যে প্রফেশনাল সাবজেক্ট, সেই হিসেবে একটা যে কোনো দেশে অথবা যে কোনো স্টেটে ফার্মেসি প্র্যাকটিসের স্ট্যান্ডার্ডটা যাতে একই মানের হয় সকল অঞ্চলে, সকল এরিয়া এবং সকল হসপিটালে। সেই হিসেবে যে কোনো দেশের যে ফার্মাসিউটিক্যাল অ্যাসোসিয়েশন এবং ফার্মেসি কাউন্সিল, তারা এই স্ট্যান্ডার্ড এবং সেটার জন্য গাইডলাইন প্লেস করে থাকেন, তা তৈরি করেন এবং সেটাকে অ্যাডপ্ট করে থাকেন। তো সেই হিসেবে সারা বিশ্বে এই ধরনের চর্চাগুলি রয়েছে। প্রত্যেকটা দেশের ফার্মাসিউটিক্যাল অ্যাসোসিয়েশন এবং ফার্মেসি কাউন্সিলের যৌথ প্রয়াসে সেই দেশের জন্য তারা হসপিটাল ফার্মেসি অথবা কমিউনিটি ফার্মেসি প্রত্যেকটা বিষয়ে, প্রত্যেকটা যে ফার্মেসি প্র্যাকটিসের প্রত্যেকটা বিষয়ের স্ট্যান্ডার্ডগুলি কীভাবে হবে সেই অনুযায়ী তারা সেট করেন। সেই বিষয়ে আমরা আজকে আলোচনা করব। আমরা গুড ফার্মেসি প্র্যাকটিস করার সময় আমরা আলোচনা করেছি একটা দেশের গুড ফার্মেসি প্র্যাকটিস করার জন্য অবশ্যই সেই দেশের অ্যাসোসিয়েশন, ফার্মাসিউটিক্যাল অ্যাসোসিয়েশন এবং কাউন্সিল তাদের একটা দায়িত্ব। তারা রিকমেন্ডেশন করেছে, FIP রিকমেন্ডেশন করেছে প্রত্যেকটা দেশের, প্রত্যেকটা স্টেটের তাদের যে প্র্যাকটিস, ফার্মেসি প্র্যাকটিস হসপিটাল এবং কমিউনিটিতে হবে সেটার জন্য স্ট্যান্ডার্ড ড্র করা এবং সেটাকে সেট করার জন্য। সেই হিসেবে আমাদের আজকের লিটারেচারে আমরা ফ্রেন্ডলি আমাদের আলোচনার সুবিধার জন্য একটা লিটারেচার, সেটা হচ্ছে দি ম্যানিটোবা ফার্মাসিউটিক্যাল অ্যাসোসিয়েশন, কানাডার ম্যানিটোবা প্রভিন্সের যে ফার্মাসিউটিক্যাল অ্যাসোসিয়েশন রয়েছে এবং সেই দেশে সেখানকার যে ফার্মেসি কাউন্সিল, তারা যে স্ট্যান্ডার্ডগুলি সেট করেছে ফার্মেসি প্র্যাকটিসের জন্য, সেটার হসপিটাল ফার্মেসি প্র্যাকটিসের জন্য যে স্ট্যান্ডার্ডগুলি সেট করেছে সেই বিষয়ে আমরা আলোকপাত করব। We will discuss on the standards of pharmacy practice in hospitals. We will discuss on the standards of pharmacy practice in hospital as adopted by the Manitoba Pharmaceutical Association and also the Council of Manitoba Pharmacy Council. So আমরা এই লিটারেচারের আমরা আজকে আলোচনা করব এবং আমরা প্লেস করব এবং এটার যে গাইডলাইনগুলি রয়েছে সেই গাইডলাইনগুলি আমরা পাবো ইন্টারনেটে, আমরা স্ট্যান্ডার্ডসগুলি এ বিষয়ে আমাদের যে আলোচনার মধ্যে সীমাবদ্ধ থাকবো। আমরা সেগুলি পরীক্ষণ করা এবং সেটাকে প্রডিউস করা তোমাদের বোঝার জন্য, এবং এটা স্ট্যান্ডার্ড আর দ্যাট মানে কি পাথওয়ে, স্ট্যান্ডার্ড পাথওয়ে অফ দি প্র্যাকটিস অফ ফার্মেসি। সেই হিসেবে আমরা যখন আলোচনায় যাব তখন আমরা বুঝবো আমরা ফার্মাসিস্ট হিসেবে প্রফেশনাল যে সার্ভিসগুলি দেব সেটার স্ট্যান্ডার্ড ম্যানিটোবার ফার্মাসিউটিক্যাল অ্যাসোসিয়েশন যেটা সেট করেছে সেটা আমরা দেখবার চেষ্টা করব। আমরা তোমাদের কাছে হলে বাই দিস টাইম আমরা লেকচার নোট তোমাদেরকে দিয়ে দিয়েছি। সেই হিসাবে তোমরা সেই লেকচার নোটে দেখবে আমাদের যে বিষয়গুলো তারা স্ট্যান্ডার্ডগুলি যেগুলি দিয়েছে সেগুলি তোমরা দেখবে এবং সেগুলি যখন আমরা এই লেকচার দিচ্ছি তার সাথে তোমরা সেটাকে সামনে রেখে সেই লেকচারটা শুনবে। ম্যানিটোবা ফার্মাসিউটিক্যাল অ্যাসোসিয়েশন হসপিটাল ফার্মেসি প্র্যাকটিসের যে স্ট্যান্ডার্ডসগুলোকে 9টা সেকশনে বিভক্ত করেছে, যে সেটা ড্রাগ ডিস্ট্রিবিউশনের ক্ষেত্রে যে স্ট্যান্ডার্ড, দেন স্ট্যান্ডার্ড ফর নাম্বার 2 সেকশনে তারা আলোচনা করেছে পেশেন্ট কাউন্সেলিংয়ের জন্য। নাম্বার 3তে তারা আলোচনা করেছে ড্রাগ ইনফরমেশন সার্ভিসের ব্যাপারে। নাম্বার 4 তারা আলোচনা করেছে হসপিটাল ফর্মুলারি স্ট্যান্ডার্ড, এবং নাম্বার 5 আওয়ার্স অফ ফার্মেসি সার্ভিস। নাম্বার 6 policy and procedure manual for the hospital pharmacy. And number 7 legal and ethical matters. Then number 8 extemporaneous compounding, and number 9 medication error. তো সুতরাং এই সমস্ত বিষয়গুলোর মধ্যে অত্যন্ত ফার্মাসিস্টদের জন্য অত্যন্ত জরুরি এবং ইম্পর্ট্যান্ট যে পদক্ষেপগুলি রয়েছে, এটার সকল কেন্দ্রিক ফার্মেসি প্র্যাকটিসের সকল বিষয়গুলি এই স্ট্যান্ডার্ডের মধ্যে বর্ণিত রয়েছে। এবং আমরা যেভাবে বলেছি, আমরা আমাদের ইন্টারনেটের মধ্যে এই স্ট্যান্ডার্ডগুলোকে অ্যাপ্লাই করবার জন্য গাইডলাইনগুলি ম্যানিটোবা ফার্মেসি কাউন্সিল যেভাবে গাইডলাইনগুলি দিয়েছে, এগুলি ইন্টারনেটে পাওয়া যায়। আমাদের আউট অফ স্কোপ, আমাদের এটা হাতে আমরা যেতে পারবো না। আমরা শুধুমাত্র স্ট্যান্ডার্ডের বিষয়ে আমরা এখানে আলোকপাত করব। আমাদের ড্রাগ ডিস্ট্রিবিউশন সেন্টার, আমরা এখন আমাদের লেকচারের আজকের প্রথম অংশে আমরা উইল ডিসকাস অন দি স্ট্যান্ডার্ডস ফর ড্রাগ ডিস্ট্রিবিউশন অ্যাজ সেট বাই দি Manitoba Pharmaceutical Association. Manitoba Pharmaceutical Association declared that the standard for drug distribution, they said that every pharmacist manager shall be responsible for the purchasing, receiving, storage, distribution, and disposal of drugs in the pharmacy. This is the standard. The pharmacy manager, every pharmacist manager of the hospital pharmacy shall be responsible for all dealings of the drug distribution. As we mentioned, and the dealing starts with purchasing, receiving, then storaging, distribution, and disposal of drugs in the pharmacy. We are discussing, will be reading it, and then necessary clarification will make whenever it is important to clarify. I will make it to you. The drug distribution starts with the activities of that centers on procurement activity of the pharmacy. Then they said regarding the procurement of drugs, the purchase of all drugs shall be under the supervision of a pharmacist and in accordance with the formulary standard. We understand that every hospital keeps their formulary for rational utilization and appropriate utilization, safe utilization of drugs. For that reason, the formulary, the pharmacists and the therapeutic centered the professionals, that means the doctors and other administrators, they sit and they fix up the standard formulary for their hospital. So whenever the pharmacist will be the pharmacist who will be supervising the purchase of the drugs in the hospital, he or she will be doing the purchase activities as per the standard of the hospital formulary. Then number B. The pharmacy department shall establish and maintain adequate records of drug purchases necessary for inventory control and legal requirements. We understand it because we have to go through long discussion. For that reason, I think if it is not important, then we will not discuss it. Then number two step is receiving and storing the drugs. The standard for it, as declared, is that number A, narcotic and controlled substances shall be delivered to the institution, that means hospital, pharmacy department directly or where applicable to the receiving area and subsequently delivered to the pharmacy department forthwith. Immediately they will. If it is noted that the narcotics and controlled drugs will be delivered, the purchased narcotic and controlled drug will be delivered to the pharmacy department directly, or if it is if there is any procedural matter that stands that it will be received in the purchasing department, then they will, if they receive it, they will immediately hand over, supply it to the pharmacy department. And number B is that the pharmacist manager shall be responsible to ensure established policies and procedures provide for proper storage of received drugs when storage within the pharmacy department is not possible. In the pharmacy department area, sometimes storage is difficult, so there might be other area where the storage will be done. Then the pharmacist manager will decide, will ensure policy among procedures so that proper storage is done for the purchased drugs. Number C, the pharmacist manager shall be responsible to ensure established policies and procedures provide for the security of all medication received during the time elapsed from the actual receiving until it is stored properly by the pharmacy. So we understand that the pharmacist manager will be responsible to ensure the established policies and procedures for the security of the medications, that means the medicines and the pharmaceuticals. Then number D, all drugs, even including investigational drugs, patients' own medication from home and clinical evaluation packages within in the pharmacy throughout the hospital, throughout the time of hospital will be kept in the pharmacy, shall be stored under the proper conditions of sanitation, temperature, light, humidity, ventilation, regulation and security. We understand it that all drugs will be stored in the pharmacy department under proper conditions for sanitation, temperature, light, humidity, ventilation, regulation and security. Number E, the pharmacy personnel shall make regular inspections of all drug storage areas. A written record shall verify that the pharmacy personnel, that means the pharmacist and other responsible officers, will be inspecting the drug storage areas and they will verify these items. Disinfectants, number 1, disinfectants and drugs for external use are stored separately from the internal and injectable medications. We understand it then they will be checking that the storage, whenever the drugs are stored, at that time the disinfectants are separated from the internal medicine and injectable items. Number two, drugs requiring special environmental conditions for stability are properly stored. You understand it? No outdated drugs are stocked in this pharmacy department. Outdated, that means expired drugs, not usable condition drugs are not to be stocked in the pharmacy department. Then number four, narcotics and controlled drugs substances are being stored with proper measures of security. Special and strict control for security purpose of the narcotics and controlled drug substances are to be maintained, are to be practiced and maintained in the pharmacy department. Drugs are not being overstocked. We understand it. Then drugs which may be required on an urgent or emergency basis are in adequate and proper supply. Whenever the drugs, emergency drugs and life-saving drugs are to be kept in area where it is needed in adequate and proper supply method and control. Then patient medications no longer required are returned to pharmacy. In the ward, if the drug that is supplied for the patient medication purpose, and if it is not required, that is to be returned back to the pharmacy. And number G standard is that standards of neatness and cleanliness are consistent with good medication handling practices. You understand it? Then it is also the standards for the inventory control is also mentioned in a brief line. The pharmacist shall maintain the inventory control system, and for drug recall procedure, the standard is that there shall be drug recall procedures that can be readily implemented. Then number 5, regarding the distribution of drugs, the text ordering, that means the prescription of the treatment sheet, or even the prescription for other ambulatory or other care area. The text of the medication orders shall include the patient's name, age, hospital number, location. In this way, all things that is required to be written in the prescription is mentioned here. So it is with you. You can check. You please check that the name of the medication and dosage is to be mentioned in the prescription. Route and frequency of administration is to be mentioned. Duration of treatment, if limited, is to be mentioned. Name of the authorized prescriber, date and order was and the date when the order was, that means the prescription order was written, the time the order was written. For verbal orders, name and signature of the persons who received the orders, that means the pharmacist, is to be kept. And then if pediatric patient, weight of the child is to be written. And provisions shall be made for sending the medication orders to the pharmacy department and subsequently retaining the original medication order on the patient's chart. We understand the medication order in original form is to be sent to the pharmacy department, and the pharmacy department, after dispensing the drugs, the pharmacy department will keep the original medication order in the patient's file. Then medication orders shall be cancelled automatically when a patient goes to surgery, and orders shall be rewritten post-operatively. We understand whenever a patient is going for surgery, at that time the medication order will automatically is stopped, and after the surgery, post-operative care, there will be another prescription or medication order. All orders should be reviewed and rewritten by the physician when a patient charge, changes service. If there is any sort of change of service, the physician will review and rewrite the medication order. The use of standing orders shall be discouraged in the hospital. The use of standing orders, if considered necessary, shall be approved individually by the appropriate hospital committee, that means medical advisory committee. In this way, the prescriber shall authorize their use and shall individualize its medication order according to the individual patient's need. You understand it? The prescriber will authorize their use and shall individualize its medication order according to the individual patient needs. We understand this is the standard kept in the hospital for the hospitalized patient as well as for the ambulatory patients. Then, regarding the standards for medication profile, the pharmacy department shall work toward developing a medication profile system for patients of the hospital. Medication profile, once developed, should be reviewed before dispensing the patient's medication. We understand that in the hospital, the pharmacy department will make and develop a medication profile, and whenever they are dispensing the drugs, using the drugs, they will be checking with and reviewing the patient's medication profile before dispensing the drugs. Then, regarding the dispensing of activities, the standards are like this. The dispensing shall be restricted to the pharmacist and authorized personnel under the direction and supervision of the pharmacist. That means the pharmacist will be responsible, either he himself or other authorized personnel, that means pharmacy technician, if they are doing, they will be under the direction of the dispensing activities, will be under the direction and supervision of the pharmacist. And the pharmacist shall be responsible for the following activities. Number A, determining the authenticity and appropriateness of the medication order before dispensing. We understand it. Then number 2, selecting auxiliary level and or cautionary statements whenever they are dispensing. They will be the pharmacist will select the auxiliary level, and if any precaution is required, the cautionary statement and level that is to be printed on the labeling paper. The pharmacist will do that. Monitoring patient profiles, if available, for the detection of inappropriate drug therapy. If in the hospital patient profile is medication profile is practiced, then during the dispensing time, the pharmacist will be check the medication profile if there is to detect any inappropriate drug therapy. Number D, final check on all aspects of the completed prescription. Whenever the prescription, in the prescription section we discussed already, that whenever the everything is done ready for the in the processing of the prescriptions. Pharmacists, before dispensing, the pharmacist will be checking the final check for all aspects of the prescription. A medication order procedure shall be developed for use when a definite number of doses or a time limitation of the administration has not been stipulated by the physician on the drug order. That means whenever there is dispensing process, if the doctor did not mention the doses or a time limitation when up to which date the drug is to be used, that type of order will be stopped. The drug specific automatic stop order policies shall be appropriate for the type of treatment when treatment given in the hospital. A drug specific automatic stop order policies shall be appropriate for the type of treatment given in the hospital. Automatic auto stop of the drug system is to be made whenever in such case, whenever the physician didn't mention the number of doses, as well as the time limit up to which time the drug will be used. There shall be a system to notify the prescriber of the impending expiration of the medication order, so that appropriate patient reassessment is completed prior to rewriting the order. Whenever the physician is rewriting the order, he will be doing the checking the medication order. Pharmacy shall use standardized terminology, metric system, and generic nomenclature of all drug levels to minimize confusion. In the pharmacy department, whenever pharmacist is in the level, they will be using the standard terminology in the level, metric units, and as well as generic nomenclature. There shall be a list of abbreviations and symbols approved by the pharmacy and therapeutic committee. In the dispensing area, whenever if there is any abbreviation used on the level leveling of on the level or the levelings of the medication, and the list is to be approved. Abbreviation that are used will be approved, and as per the direction of the pharmacy and therapeutic committee. Medication levels shall be typed or machine printed and shall be free from erasers and strikeovers. We understand whenever the medication level is printed at that time, the pharmacist will be careful so that there is no eraser or typed anything strikeover. That means there is any over typing of the any area of the statements. The levels shall be firmly fixed to the container. We understand these are the policies and these are the standards for leveling. Medication containers shall not be altered by anyone other than the pharmacy personnel. We understand it. Then regarding the unit dose medication system, it is mentioned that the unit dose system shall dispense medications contained in and administered from unit dose packages. In unit dose system, the dispensing will be done in the unit. The dispensed drug will be contained in unit dose packages. then not more than a 24-hour supply of unit dose medication shall be provided to the acute patient care area at any time. We understand in acute care area, if the medication is delivered in the unit dose system, the unit dose supply will be done for a maximum of 24 hours. The medication ordered for the unit dose medication system, the medication profile, if available, shall be utilized for the individual medication doses to be scheduled, prepared, distributed, and administered on a timely basis. We understand whenever in the dispensing area the drug is prepared as the unit dose system, at that time the medication profile is to be checked by the pharmacist, so that for the medication dose to be scheduled, prepared, and distributed for the patient. Unit dose charts or medication trays shall be used as medication storage facilities on the ward. The medication medication dose cards and medication trays shall be used in the medication storage facilities on the ward. The particular tray for a specific patient shall be labeled with the patient's name, location, and hospital number. We understand it. Labeling for the patient's particular patient's tray is to be written with the name and location, that means in which ward, and hospital number for the patient is to be written on the tray. The following information shall be indicated on individual dosage package. Whenever unit dose unit dose are prepared, at that time on the level, these 4 things are to be written. Number on the individual dosage package, the name of the drug, strength, expiry date, and lot number. Individual patient prescription. Medication shall be dispensed in individually labeled prescription container. All medication that is dispensed for individual patient, like ambulatory care area, individual patient, that is to be labeled on prescription containers. The amount of drug dispensed shall be determined by the hospital policy. We understand it. The hospital will decide the amount of the drug to be supplied to individual patient at a time. Medication for administration shall be labeled with the following information: name of the patient and location, that means which area, the name and strength of the drug, dose, route of administration, accessory or cautionary statements as required, date, dispense, and name of hospital. This should be printed or written on the level of the medication that is packed on the prescription containers. This is for regular drugs, and these are all regarding regular drugs. And now the controlled dosage system. Medication shall be dispensed in individually labeled controlled dosage container. The controlled drugs shall be dispensed in individually labeled controlled dosage cards and containers. The system shall be designed so that each dose is designated for a specific time of administration. There should be a system when and how the controlled drug at which specific time of administration it is to be designed for each dose. The amount of drug dispensed shall be determined by hospital policy. This sort of policy are done by the Pharmacy and Therapeutic Committee. Medication for administration shall be labeled with the following information for the controlled drugs: name of the patient and location, that means in which area, what is his bed number, etc. Name and strength of the drug, dose, route of administration, accessory or precautionary statement, cautionary statements if required, date dispensed, and name of the hospital for the controlled drugs. The pharmacist shall exercise professional judgment at completion of dispensing procedure to ensure that right drug is dispensed for administration to the right patient in the right dose via the right route and right time. We understand it. Whenever the controlled drugs are dispensed at that time, all these things, all this is to be matters is to be fixed up by the pharmacist so that everything right, fully done. Then, regarding the policy for the delivery of the drugs, discuss. We'll read it, and if explanation is not required, I think these statements are written in such a way that in many cases, as we discuss the pharmacy practice in the undergrad and as well as master degree level, we can understand it. We are reading and checking the standard for the Manitoba province, as those set by the Pharmaceutical Association of Manitoba. Then delivery of the prepared drug from the dispensing area. Medication shall be delivered to the ward from the pharmacy with the least amount of delay. You understand? All parts of the transportation system shall protect the medication from pilferage and breakage. We understand it. So that there will be precaution, there will be measure will be taken for the security of the drug, so that no pilferage, that means theft or breakage of the medication, happened whenever in the delivery time. If the drugs are from the pharmacy department are transferred to the ward or other area, that should be done so that no pilferage, that means no theft issues occur and no breakage occur. The special procedures for delivery of narcotics and controlled medication shall be established to ensure that the drugs are delivered promptly, intact, and placed in proper storage area. You understand? The special precaution is required whenever we are delivering the narcotics and the controlled drug substance, so that immediately it is delivered in the intact and in the proper storage area of the ward. Then return medications. The standards were regarding return medications. Owing to the inherent danger, drugs having different lot numbers and expiry dates should not be combined. We understand, different lot number, different expiry date drugs should, that came from as the return medication should not be mixed. Then the medications dispensed for administration but not used shall be returned to the pharmacy department to be sent to the ward, and if certain thing happen, either the treatment changed or the patient has some sort of the patient is not using the drug. At that time all drugs is to be returned back to the pharmacy. Procedures for returning drugs to stock shall be instituted in the hospital. There will be procedure. The procedure, necessary procedure, is to be developed. This shall include the following considerations. Number one is that integrity of the returned drug package and proper storage of the drugs on the nursing care station, whatever the drug is supplied for the patient's use is to be checked so that proper storage of the drugs are done in the nursing care area. The following types of medication shall be discarded. Return medication, this type of drugs is to be discarded. And these are the standards for practice in the Manitoba province. Any opened topical medications, including ophthalmic, otic, and nasal medication, these are to be discarded. Number two, opened multi-dose and single-dose vials. Number C is that any medication handled by the patient. Then D, any medication returned by ambulatory patients, improperly stored medications, any open or used IV admixtures, any open liquid medications. This sort of medications, if it is returned to the pharmacy department, these are to be discarded. And ward stock medications. The pharmacy shall establish a list of ward stock medications for each ward, and list shall be reviewed on the annual basis by the pharmacy department. That means ward stock, that means floor stock. Whenever the pharmacy department along with the nursing department, they will establish a list of the ward stock, free stocks, and other stocks. Number two is that the supply, distribution, and control of the ward stock medication shall be the responsibility of the pharmacy department. Then narcotics and controlled drugs may be provided as a special form of ward stock and shall be stored in the secured area in accordance with legal requirements. Legal requirements of the narcotics and liquor department, whatever they mention, according to them, according to the legal purpose of security, that is to be done in the ward. Narcotic and controlled drugs may be provided on a special form of ward stock. Other specified drugs shall be stored in a regular manner. Emergency drugs shall be readily accessible and stored appropriately. These are the standards for the ward stocks. And number 11, medication is stored on the ward. Medication shall be stored securely on the ward and available to the authorized personnel only. Medication. Then investigation. Regarding the investigational drugs, investigational and emergency release drugs shall be used only under the direct supervision of the principal investigator. This are regarding the investigational drugs. And number B, be approved for use by the appropriate hospital committee. Investigational drugs are the process of investigation and emergency release of the drugs is to be approved by the hospital committee. The way the investigational, the protocol of using the drug as the investigational drug is to be approved by the hospital committee, be administered, investigation drugs be administered by personnel only after they have been given appropriate pharmaceutical information to the drug. The drug, whenever they are administered, before that the personnel is to get all sort of information that are required to administer the drug properly. And D is that the responsibility of the pharmacy department for storage and distribution of the investigational drugs. These are the standards for the investigational drugs. And regarding the administration of medication, we are running with the time. The time is almost closing, so I will recommend you to read. I will check a few of it regarding the administration of the medication. Within the institution, written policies and procedures governing the safe administration of drugs to patients shall be in place and shall include the following. Number A, drugs shall be administered only upon the order of the medical or dental practitioner. B, all medications shall be administered by adequately licensed personnel, that means registered and licensed personnel, in accordance with the law and regulations governing such acts. We understand all who are administering the drug, and they are to be licensed. Number C, whenever medications are added to parenteral products, acceptable precautionary measures shall be developed, which would include proper auxiliary labeling regarding the name and amount of the drug added, date and time of addition, patient's name, and the person who prepared the mixture. Number D, medication shall be given as near the specified time as possible. The medication, whenever administered, is to be given in appropriate time. Then the patient for whom the medication is intended shall be positively identified in accordance with the hospital policy. Number F, all administered, refused or omitted medication doses shall be recorded on the patient's medical record and chart. Number G, self-administration of medication by patients shall be permitted when specifically ordered by the physician. We understand it. If the physician allows that the patient will self-administer the drug, then at that time the drug will be administered by the patient himself. Then number H, all medication errors shall be reported immediately as the medication error and incident standard as described here in this list, in this book, that in this chapter. Then adverse drug reaction reporting is to be done properly. Procedures for drug administration by respiratory technologies. There should be the standard procedure for drug administration by the respiratory technologies. And there is patient's own medication. Patient's own medication in the hospital should not be administered unless they are identified and written orders to administer the specific drug by the physician. Regarding the drugs, if the patient bring it, if the pharmacy department and the physician cannot identify the drug, and if the doctor do not allow the drug to administer, this will not be administered. And regarding the alcoholic substances, the standard practice is written like this: the pharmacy department shall ensure policies and procedures are developed for the control, distribution and storage of the alcoholic substances for compounding and dispensing purposes. The pharmacy department will make the policies and procedures regarding whenever they are compounding the alcoholic substances, then they will be policy and they will make the policies and procedures. This is the responsibility of the pharmacy manager or the hospital. Then the institution shall have a special permit from Manitoba Liquor Commission for the medical use of the alcohol. These are the standards regarding the distribution of drugs in the hospital. Thank you. We'll be after a few moments. I will deliver the lecture, second lecture, part two lecture in a few moments.